Hey class, this is Chanel Ouse, and I'm starting off our presentation for my group members, Joanna Munoz, Ariel Bunag, Jessica Lopez, and myself. And we decided to do our project on lung cancer among Asian Americans. So first, we're going to go ahead and discuss what exactly lung cancer and cancer are defined as. And cancer is essentially the uncontrollable spread of cells within the body. And this uncontrollable spread is the result of a mistake in our DNA process where the DNA can become mutated to either accelerate cell replication or inhibit the controls that stop the process. With lung cancer specifically, there are two types, with one being small cell and the other being non small cell. There isn't really much of a difference between the two, it's mainly just the difference in the types of cells that are in the lungs. But non-small cell is much more common than small cell, with it accounting for 80 to 85% of lung cancer. This particular cancer is also the third most common type of cancer and has the highest mortality rate of any cancer there is. It is most commonly contracted through smoking, vaping, or secondhand smoke. Genetics can also play a role in whether or not an individual develops this kind of cancer, but it is less common than those mentioned before. So next, we're going to go ahead and look at the different health disparities that exist within the Asian American community and lung cancer. So within the Asian American community, the rates of smoking are actually lower than that of other racial ethnic groups, but very prevalent in Asian subgroups. So for example, Southeast Asians have greater rates of smoking, with cancer presenting at a rate that is 18% higher than their white counterparts. And within the Asian American community, those of the first generation experience poverty at 13.2% and unemployment at 4.2%. So after looking at these statistics, we can go ahead and look at the different disparities that exist within the Asian American community. And so one of the disparities we can look at is language. There exists a multitude of languages such as Korean, Khmer, Japanese, Tagalog, Thai, Vietnamese, and so many more. And with these languages, it can be very hard for physicians to properly get across to their patients what their diagnosis is and what the proper treatment is for that diagnosis. And so this may be things like chemotherapy, medicine, another form of therapy that patients may not be able to understand that they need. And with the different poverty rates and unemployment rates, this is another health disparity we can look at. So given that they are unable to afford proper health care, they're unable to receive the proper diagnosis for their disease. So they may not be able to actually get the diagnosis in time for lung cancer, which will lead to a higher mortality rate.
Next, we will be discussing the theoretical framework. For our topic, we chose the Mayer's model of disparities. This framework provided evidence of health disparities among ethnic groups and the major evidence on the role of exposure to ethnicity and SES related stressors on health. This model argued that at the core of the ethnic health disparities is differential exposure to psychosocial adversities moderated by inadequate access to and controlled over essential material, psychological, social, and healthcare resources over time. Mayer also believed that health disparities can be explained, at least indirectly, by the strength of the associations between low SES and such negative cognitive emotional factors such as hostility, anxiety, depression, and feelings of hopelessness. Theoretical framework continued. Mayer's model also acknowledged that the hypothesized stress biological process disease pathway is likely moderated by a number of psychosocial and behavioral factors, including psychological characteristics, lifestyle factors, stress appraisal, and coping strategies used by the availability and use of social resources. Stress and anxiety go hand in hand in a cancer diagnosis. It is tempting to want to avoid talking about addressing the problem, yet not talking about a problem will not make it go away. In general, it is much better to actively address the problem and figure out a solution.
Hi everyone, this This is Ariel speaking. So now I will discuss the psychological pathways associated with lung cancer among Asian American populations. First of all, we will examine the concept of acculturation stress as a psychological pathway. Acculturation is defined as a process of change that occurs when individuals come from different cultures and interact with the host regions, which is usually developed by following migration, political conquest, or forced relocation. AANHPI stands for Asian American, Native Hawaiian, and Pacific Islander immigrants who are confronted by a myriad of difficulties due to the process of acculturation to the United States. As one of the fastest growing minority groups in the United States, Asian Americans are faced with a myriad of obstacles related to acculturation. This may include language barriers, age gaps, gender norms, occupational issues, family structure and intergenerational issues, religious, cultural beliefs, traditional beliefs about mental health, and discrimination and stigma. Thus, healthcare providers are less likely to assess individual needs, which leads to physical and psychological health disparities. Overall, this diminishes overall quality of care and makes Asian Americans more susceptible to illnesses. Furthermore, accumulated research has shown the impact of acculturation on high stress levels. Considering that most Asian Americans are first or second generation, cultural adjustment and acculturation have been salient to the experiences and systems of this population. In particular, Asian American immigrants who have spent more time in the United States and who have endorsed a higher level of acculturation have shown poorer health outcomes than those who have immigrated more recently. Since Asian cultures embrace collectivism, life transitions and occupational disruptions can be overwhelmingly stressful. It is also common for Asian American populations to deny the existence of mental illness. This setting engenders major emotional distress for Asian American Pacific Islander populations, causing many to resort to maladaptive coping mechanisms such as substance use. As a means to cope, those who have spent more time in the United States are more likely to smoke cigarettes. In this table, you can clearly see the traditional beliefs and negative stigmas in response to mental illness among certain Asian American subgroups. On the right, labeled coping behaviors and treatments, you may also see some maladaptive coping mechanisms or alternative modes for treatment. It should be of no surprise that smoking cigarettes is a major contributor to the high levels of cancer-related mortalities within the Asian American population. National data of Asian Americans include, but are not limited to, Chinese, Japanese, Korean, Vietnamese, Filipinos, and Hawaiian Pacific Islanders. Most often, the AANHPI communities are clumped together as one monolithic group when we know it is a highly diverse population. Ethnic differences were found in a number of pathways linking social network characteristics, perceived social support, and lower recent cigarette smoking. Like Chanel has mentioned, we know that the Asian American population does smoke less compared to other ethnic minorities. But when you disaggregate data, 8.9% of the entire population smokes cigarettes. When researchers further disaggregate the data, Native Hawaiian and Pacific Islander adults actually have a higher prevalence rate in their current tobacco usage. 18.3% of the population smoke cigarettes, which means almost 1 in 5 of these individuals will be tobacco users. Okay, so now let's consider the cultural and social networks that impact people's decision to start smoking cigarettes. Social and interpersonal processes shape behaviors, which include health risks like cigarette smoking. Accumulated research has shown that the greater number of smokers within a person's social network does increase the likelihood that that individual will smoke. Intergroup differences highlight that the AAPI community vary in network characteristics. This means that although Asian culture commonly accepts the values of collectivism, it may not be a protective barrier against cigarette smoking across all groups. Okay, so now let's consider the cultural and social networks that impact people's decision to start smoking cigarettes. Social and interpersonal processes shape behaviors, which include health risks like cigarette smoking. Accumulated research has shown that the greater number of smokers within a person's social network does increase the likelihood that that individual will smoke. Intergroup differences highlight that the AAPI community vary in network characteristics. This means that although Asian culture commonly accepts the values of collectivism, it may not be a protective barrier against cigarette smoking across all groups.
Now for the interventions for lung cancer among Asian American population. Just want to start off by saying that the ribbon color for the cancer is white. And falling over to my other slide, there I had found out that there is not a lot of studies on cancer, lung cancer for Asian Americans is very limited, and I will be talking about that in the next slide. One of the studies I found that impacts the Asian American population on lung cancer is exercising, meaning that according to Chen 2005, his study shows that the Asian American population mostly eat fruits and vegetables, which is good, but they are also the least likely to exercise. And this is crucial information as we can see how exercising and also eating a healthy lifestyle, you need that balance in your life. So we saw in the study how this impacts them, and leading on to how society does also take an impact on American Asian population. So again, by Chen 2005, he states how society can also help when using media for showing interventions for lung cancer by targeting the Asian American population and using culturally and linguistically media messages, which studies show that is effective. So we can see how not having targeted, effective media messages towards a population, specific populations, can affect them. And just like how Chen stated here, it does affect them and it should be changed as we are going, especially in the United States, in a diverse population. Now, sadly, there is not a lot of studies on the Asian American population targeting cancer, and the ATECAR, which is the Asian Tobacco Education and Cancer Awareness Research, is putting effort in fighting interventions programs and helping and analyzing this specific population. They are also were made so that there are more participation of cancer clinical trials for Asian Americans. So what the ATECAR did find is that the interventions that is based on their language and culture shows to be effective toward the population. And we can see how that makes sense, because if you are not culturally into the American society or speak fluent English, we can see how being affected toward the population and having different languages targeting this population specifically will help them in knowing what they should be doing and what knowledge they need to have for cancer. Next, I also found just a little bit studies on Asian American population, but I did find mostly of them were based for lung cancer were based on quitting smoking to reduce lung cancer, which is called the smoking cessation intervention, which doesn't really help because the smoking cessation intervention just means to like quit smoking, quit everything like cold turkey, and it doesn't give them any steps in how to do that, or just using patches to help them go through it. It doesn't help them in finding other things that they can do to help them like reduce any things there are, so that makes them have lung cancer and any of that area. Now leading on to again Chen, the author Chen, he made a lot of studies on the Asian population community, which is what I found a lot of. So Chen 2020 also stated that putting language and culture first improves intervention and education on cancer in general. And again, we can also see how that makes sense because we need to have that connection with the media or with the population to know more information, knowledge, education on this very crucial disease, the cancer, you know. So also leading to our another research I found, according to Feng, Nguyen, Stewart, Chen, and Tong's 2018 study, they stated that a community-based education is important and shows to be effective, especially for those who have low acculturation or education. When I was going through finding research about this, especially basically on intervention on how to reduce or be aware more about lung cancer in Asian American population, was very surprising, and I was in shock of how there is not a lot of information and research, and I believe that this needs to change. And what do you all think about what these findings were, what the lack of information we have now? I believe that we should make a pursuit in finding more information and having more clinical trials for the Asian American population, as cancer is a big disease that needs to be aware, and we can treat it, or maybe we can treat it, or just find more information of how we can help our population and our people in our country and everywhere else.